So epilepsy is a brain disease where people will have recurrent seizures. A seizure disorder and epilepsy are actually the same thing. Seizures are like electrical storms in the brain, like a short circuit in the electrical connections in the brain. And seizures can do lots of different things. They can cause people to have staring spells. You can have convulsions. You can have other things that are unusual, even unusual odors, or you can see flashing lights. It can be very confusing at times. Sometimes people with epilepsy don't know that they have epilepsy and they need to be evaluated in the hospital or in the clinic. The symptoms of epilepsy are varied. Most of the time, people with seizures will have changes in their awareness. So you can lose time, or you can have altered awareness and have a dreamlike experience that can last seconds or minutes, or sometimes longer. Sometimes people have twitches or convulsions. You can also have other things that are related to seizure activity in the brain. The thing that I find very interesting about epilepsy is that there are all these different circuits in the brain. And when they malfunction with a seizure, you have problems along that circuit. And so the brain does many things, and so seizures can manifest in many different ways. And so there are many different kinds of seizures. Epilepsy is diagnosed with testing that can include brain imaging. It can also include lab testing. And then also very important is to do an EEG. So an EEG is a test, it's like a brainwave test. An EKG is the heart waves, and an EEG is a brainwave test where you can actually look at the rhythms of the brain. So as far as testing for epilepsy, we actually can do all the testing here in Vernal, which is really nice. We can do very high quality EEGs. We can do more extensive testing in the hospital with video if things are confusing. We can do all of the imaging that's needed, and of course all the labs. So as far as treatment of epilepsy, epilepsy can be treated with medications, and then there are other things besides medications that can be used. There are many different medicines, and the medicines now are much better than they used to be. There are things besides medicines that can be used, such as there's a device called the vagal nerve stimulator that can be implanted, and that is like a pacemaker for the brain, and that can actually help when medicines fail. There are other things like doing certain diets. Many people with epilepsy are actually able to function well in their jobs, in school, and work by taking the medicines. And so people can return to driving, people can have children, but it's important to control the seizures because without treatment, epilepsy can be very dangerous. If you think that you have epilepsy or think that you might be having a seizure, or someone that you know might be having a seizure, it is helpful to have them evaluated by a doctor. The place to get started is really with your primary care provider. You can go to your primary care provider and talk about it and decide if you need to see a neurologist. If you do, then you can come to our clinic, and we accept most insurances, and we can get you evaluated and treated if you need it.